I'm welcoming you today to this discussion of a very interesting topic, very relevant to our current situation relating to the COVID-19 pandemic and the severe personal impact this had on you and many millions of people globally just like you. Mastering the Fourth Industrial Revolution was the 2016 theme of the World Economic Forum annual meeting in Davos clusters in Switzerland, but I will get back to that topic later. As we struggle to adapt to the ever-changing technologies around us, we also have to admit that these technologies have become part and parcel of our quality of daily life. Just take your Netflix streaming or your email or online flight booking or online payments. We have indeed become completely dependent on these solutions. Imagine just taking any of these away and, heaven forbid, taking your mobile phone away. And you would realize, whether we like it or not, we have become interdependent on the physical and technology world and the benefits it brings. Allow me to invite you to be part of a pioneering experience of such a new technology and solution, which I know and believe will become part and parcel of your life for the future. Imagine private banking and the ability and the freedom you have to access your financial information from anywhere in the world and using the tool to manage your finances from your own mobile or your PC. Now imagine to be able to do exactly that, to access your health records from anywhere in the world. And imagine you to be the sole owner of your own data and being able to decide who you would share this with, when and how. In less than 4 weeks, we will launch one of the world's first personal blockchain-based electronic health record systems from our clinic in Malahide. This launch is part of a world-first study and is called the Dublin Study. And in collaboration with my colleagues and researchers from universities and institutions here in Ireland, Northern Ireland, United Kingdom, Australia, China, Taiwan, Germany, Switzerland, Canada and the USA, we will take the first steps to enable you and populations around the globe to take charge and control of your own personal medical records. So what is the study about? The first 600 clients to sign up for the study will become the world's first owners of a personal electronic health record, and you will become part of history in the making. As part of the Dublin study, you will be offered 3 different COVID tests, and the results of these tests will be recorded in your personal electronic health record for you to access from anywhere in the world. The COVID-19 tests will be able to determine if you perhaps had COVID and if you have any antibodies. If you were already vaccinated, we offer a unique and the first CE-approved test in the EU for neutralizing antibodies after the vaccine. Do you actually have antibodies after the vaccine? This is the way to find out. The secure system that complies with GDPR and international data and cyber safety regulations, HIPAA and many others, is based on blockchain and other Fourth Industrial Revolution technology solutions. As a matter of fact, the system was developed on existing Ethereum blockchain technology, employing all the advantages of cryptocurrency security for your personal health data. Just like with your Bitcoin, you will own the key to your personal electronic health record, and you can open or lock your file just like you would do for your bank account. The EU directives for the electronic health record were already issued in 2014 and actually encourages the use of blockchain-based electronic health records in the EU out of concerns for cybersecurity and hacking risks of current health record systems currently in use. In this regard, I do not have to say much. In April 2021, following the massive impact of the global COVID-19 pandemic, the EU Parliament endorsed the EU-wide Green Passport, a perfect example of a personal electronic health record for all citizens of the EU to enable free movement again and to help people to return back to work and travel. The EU-wide accepted personal electronic health record is a historic move that we believe will trigger the need and acceptance of the personal electronic health record for the individual globally. This could not have come at a better time for the Dublin Study and the launch of a comprehensive electronic health record for the individual. The EU passport will hold only your COVID-19 related profile and nothing more. The Dublin Study will employ not only this record, but aims to illustrate that individuals and communities are ready and able to take charge of their own medical records and manage this. This have never been proved or illustrated or tested in a large cohort use before. And that is exactly what we need to do in the Dublin Study. The study will examine the feasibility and readiness of the individual to control his or her own health records and will further aim to confirm that the individual is ready to add and manage their own medical records. Just imagine one place where all your medical information, blood results and scans and reports and personal health data and notes could be securely stored and managed. With the aid of the International Faculty of Epidemiologists, the Dublin Study will further aim to examine the ability of the individual to record daily symptoms over a period of time to create a health profile and detect any changes in your health status. Being able to record your own health status in real time in future pandemic outbreaks will be crucial to keep safe data and protect yourself and your loved ones. This will further prove that institutions and governments will be able to create safer, more effective and better health guidelines. This will prove that we never have to accept the destructive spread of a virus or infections in the future again, and that we can reduce mortality and protect the vulnerable and reduce the risk of total lockdowns. So what about your information collated by your doctor, hospital and health services? Will this change? This is unchanged, and according to GDPR legislation, you have ownership and access rights to your own data, which you can import into your own electronic health record. Currently, most people's health record are owned and controlled by hospitals, health practitioners, and the National Health Service, and they are difficult to access. The integration of medical data will be done gradually over a period of time in a controlled way, and the Dublin Study will examine and establish if the individual wants this, and if the individual is ready to co-share some of the shared data with the state or a third-party healthcare provider. The paradigm shift is clearly moving the health data ownership, responsibility and the management of the same away from the existing health record keeping system models where the state, hospital, doctor or private entity has sole control of this data and handing this to the individual patient to co-share and co-manage. In the end, the Dublin Study will establish if the use of such a system can change the outcome of the current and future pandemics, and if the personal electronic health record could change the course of history in the way we manage destructive infections and pandemics and prevent total destruction of communities. Our vision is to create a safer world by empowering people to better control their health. Users will own and can access their health records anywhere, anytime, and they can choose to share them with the doctor if needed. The solution will help people to stay healthy longer and will contribute to better diagnosis, treatment plans, and to reduce morbidity and mortality. Very few people organize their health records accurately, and even if they do, it is difficult to find them when you need them. If you want to be able to access your records accurately, make sure you sign up for the Dublin Study and have your say. We have imagined a world where people can access their health records anywhere, anytime, and they can choose to share this with their health practitioner with a click of a button. If you want to be able to do this, make sure you sign up for the Dublin Study and have your say. We believe that in a few years, this will become as natural as booking a flight or transferring money online. Can you imagine the power of accessing previous health records in an emergency and how many lives could be saved through this? If you want to be able to do this, make sure you sign up for the Dublin Study and have your say. On the point of the World Economic Forum meeting in 2016, Mastering the Fourth Industrial Revolution, little did the world know how quickly we all would have to embrace the 4IR solutions and how quickly we have to learn to master these to make life better and safer for each and every one on this planet. Born out of need, hardship, suffering and destruction, we should never let this happen again. And this is not only the responsibility of world governments and the World Economic Forum. This is also mine and yours. Embrace this opportunity and have your say. Signing up for the Dublin Study will commence in the next 2 to 3 weeks with limited numbers and tests available. Please join the Dublin Study and take part in this world-first experience and help us to do and manage pandemics better in the future.